Imagine sitting wide awake in a dark room while someone starts cranking a metal drill bit directly into your skull. This is trepanation, a clinical, prescribed cure. Physicians deduced that chronic migraines meant a mass of pressure, or an evil spirit, was trapped inside your head. The drill provided an escape route, using crude hand tools and absolutely zero pain medication. Yet bone fragments recovered by archaeologists tell a surprising story. The smoothed, healed edges around these drill sites prove many actually survived the ordeal. To a modern observer, scraping a hole into a conscious person's head looks indistinguishable from torture, but early practitioners genuinely believed they were providing relief. To understand the worst medical treatments in human history, we must look past the brutality. These extreme practices were the deadly, misguided first drafts of medical science. The foundational logic of early medicine was straightforward. If you want to fix a broken machine, you first need a map of its internal parts. In ancient Greece, physicians like Herophilus and Erasistratus took that logic to a horrifying extreme. They gathered live, conscious criminals and performed human vivisections. They cut into living subjects specifically to watch beating hearts and severed arteries in real time. By observing the vascular and nervous systems while they were still functioning, these early anatomists paused agonizing trauma and massive blood loss. This diagram visualizes humorism. Doctors concluded the body functioned like a container filled with 4 vital fluids. Illness was a physical imbalance. If you developed a fever, your container had too much blood. The logical treatment was to drain the excess. Physicians aggressively sliced open patients' veins or applied dozens of blood-sucking leeches. These ceramic storage jars highlight how routine and industrialized this fluid-draining process became. The pursuit of an internal balance ironically robbed infected patients of their vital fluids, drastically weakening their immune systems and accelerating their deaths. By the 12th century, when bloodletting failed to cure severe internal ailments, European apothecaries turned to far more extreme pharmacological solutions. A widespread belief took hold that preserved human remains possessed miraculous, concentrated healing properties. This led to the normalization of medical cannibalism. Apothecaries ground up stolen, embalmed Egyptian mummies into a fine powder, packaging it in jars like these, to prescribe as a cure for the bubonic plague and internal bleeding. The demand for this miracle powder eventually stripped the supply of actual ancient mummies. Unscrupulous grave robbers filled the economic void by digging up fresh corpses, dehydrating them, and selling them to desperate patients as fake mummy powder. Meanwhile, out on the battlefields of the Dark Ages, surgeons faced a completely different kind of trauma that required immediate, catastrophic physical intervention, limb amputations. A severed limb presented a rigid mathematical problem. A patient with a major arterial wound would bleed to death in a matter of minutes. The flow of blood had to be stopped instantly, regardless of the pain. The solution was extreme cauterization. Surgeons took a glowing red-hot iron straight from a fire and pressed it directly into the open wound, violently burning the flesh to melt the blood vessel shut. It achieved the immediate goal of stopping the bleed. But surviving the procedure meant enduring agonizing shock, and the burned dead tissue almost guaranteed a massive, often fatal subsequent infection. Drilling open skulls, dissecting live subjects, consuming powdered corpses, and burning severed limbs with hot iron. None of these practices were driven by intentional cruelty. They were rational, deductive responses to a desperate human need to relieve pain and stave off death. Early humanity was forced to maintain and repair the most complex biological machinery on Earth, entirely without an instruction manual. The sterile safety of modern hospitals and the precision of contemporary surgery exist today because we are standing on top of centuries of brutal, bloody trial and error. The pursuit of health is paved with terrifying mistakes. If you want to discuss the strange history of medicine or suggest an idea for the next video, join the Discord using the link in the description.